Hi everyone, we're going to talk about Chapter 11 now, breastfeeding. This PowerPoint was designed by Lee Lindsay, a nurse midwife in town, and so we'll use this that she created for us, and I might be adding some other things into it, and I will let you know where I find those. So just as a review, we know that breast milk is the ideal food for newborns and infants, and it supports their nutrition needed for good growth and development. It is also filled with healthy nutrients that assist with immunity and protect the baby against infections. Breastfeeding also offers both parent and baby physical, psychological, and emotional benefits that will last a lifetime. And it's important that we support our breastfeeding moms. In our previous chapter on nutrition, we reviewed what the standards are for breastfeeding, and Healthy People 2020 recommend that all little ones up to 6 months of age should be breastfed, and then with supplementation be continued breastfeeding from 6 months to 1 year, as long as it is good for both mom and baby. Our role in this as practitioners is to offer promotion that all the benefits of breastfeeding, early support, and then to assist with any problem management. We know that breastfeeding is the ideal nutrient for babies, but there are a few contraindications to breastfeeding. If mom has certain infections and certain drugs are utilized, these can be passed through the breast milk to the baby, so that may indicate that breastfeeding is not an option at that time. You will also find on page 200 in the blue book some contraindications to breastfeeding, and you can just review that at your leisure. We are not going to go over the individual characteristics of breast milk, but it is unique to each child, and its importance cannot be underestimated on the benefits that it offers. Scientists are finding new components to breast milk and clarifying their purpose, and at this time there's more than 200 different components of breast milk that have been identified. When we are working with parents that are wanting to breastfeed, it's important that we assess what the maternal expectations are for breastfeeding, learn more about what their knowledge base is, and especially making them aware of techniques to get nursing off to a good start. A nipple evaluation must be completed, and this should be on all pregnant women and not just on those with their first baby. Let's talk a little bit about some issues that you can have with nipples, whether they be flat or inverted. A nipple can look as though it is inverted, but you can conduct a pinch test to determine whether how the nipple will react during breastfeeding. If the nipple pulls in during the pinch test, it's inverted, but if it doesn't pull in, and most often doesn't, and everts with compression, it's considered to be flat. Inverted nipples can be difficult for the infant to latch onto in the early days, and it may become harder to pull the nipple into the mouth for sucking, but as the baby continues to breastfeed, that nipple elongates and makes it a little easier, and successful breastfeeding is more possible. For flat nipples, they do not generally change over time, but the infant can develop a style to more easily latch on. Flat nipples may be seen in more larger breasted women. In the prenatal phase, breast shields can be used during the third trimester for inverted nipples to help those be stretched somewhat. In the postpartum phase, it's important that support is there with mom when they're trying to nurse, to help with different techniques that might assist the baby in latching on. Research has shown that using the football hold position during feedings and having the mom lean forward helps the baby to latch on. Pain and trauma can be a concern when mom is trying to get the baby to latch on, and improper latching on is one of the key reasons to have pain at the breast, and then trauma can occur. Other causes of soreness of the nipples can be caused by irritation to the nipple or the areola, and this is often caused by breakdown of the skin. Prolonged negative pressure can cause pain to the nipples. Using soaps, creams, or lotions that include alcohol or other irritants can cause issues with the skin. Using breastfeeding supplies incorrectly can cause pain or trauma, so it's important that mom has been instructed well on pumps, shells, and shields. Another condition is called nipple thrush, and that is when candida can develop on the areola and the nipple. Mastitis can also cause pain or trauma, and this is an infection of the breast. And then also there could be a variety of infant issues that could lead to pain or trauma. So let's talk a little bit about nipple thrush. The skin, the nipple and the areola may appear as red and shiny. The skin may be itchy, it may burn, there may be persistent cracking. If there has been trauma there, it is less likely to heal as quickly. You can have more of a deep, intense breast pain, and with persistent nipple thrush, that can lead to mastitis. It's important to educate mom that they shouldn't have more than mild tenderness. The nipples can be damaged by this constant high negative pressure and don't toughen up as breastfeeding progresses. You can have cracking and bleeding of the areola, and that is not normal. So it's important to assess breastfeeding at an early time after the baby is born to prevent problems from happening and reinforcing proper latch-on techniques and positioning of the baby. If there's concern that the areola and the nipples are tender, rubbing a few drops of colostrum onto the nipple and the areola after every feeding and letting it dry helps to create a barrier. Also, allowing the nipples to be exposed to air for short periods of time, several times a day, also helps with this tenderness. If wearing a bra or having clothes next to the nipple are causing tenderness, using a breast shield will help the bra or clothing from rubbing against the nipple. Other suggestions to help with nursing: have mom nurse from the least sore side first. Use short, frequent feedings, and if the affected breast is too painful to nurse, then pump. And also the use of analgesics is necessary, and then referral to a lactation consultant. Next, let's talk a little bit about mastitis. So some symptoms include local tenderness at the area, some redness or heat. You may notice a low-grade fever. They may be a little more tired than usual, and sometimes you can have some nausea and vomiting with it. Something that we didn't review is that there are some predisposing factors that can be seen with mastitis, and that might include stress or fatigue of the mom. If the mom had cracked nipples or any plugged mammary ducts, if her bra was constricting or improperly fitting, that could allow for milk in the ducts to sit. If there's inadequate emptying of the breast, and if there's sudden weaning or a significant decrease in the number of feedings. Those are all some factors that can lead to mastitis. Some of the most common organisms associated with mastitis are Staphylococcus aureus, Streptococci, and Corynebacteria. So when you're trying to help these moms with mastitis, the most important thing is to make sure that the breast is emptied. It's important to nurse frequently, or if the pain is too severe, to pump. It's key to let the mom know that the milk is not affected at all and it's fine for the baby. There's research that shows that certain lactobacillus that are found in probiotics can be just as effective in helping manage mastitis as antibiotics can be. So these are probiotics that have been isolated from human milk, so that if you have a mom that is not wanting to take any medications while she nurses, this may be an avenue to go down. Treatment typically includes the use of oral antibiotics, such as a penicillin-resistant penicillinase resistant penicillin or cephalosporin that covers Staph aureus, and treatment is usually for 10 to 14 days. dicloxacillin has often been used, and then augmentin and cefuroxamine have been used with few adverse side effects. It's really important that moms rest during this time as they are fighting an infection. Important to drink lots of fluids, and then taking either warm showers or warm compresses to the breast will help. Some issues from the baby's perspective that may cause pain or trauma include issues with the baby's mouth, mandible issues, whether the frenulum has gotten in the way, difference in the shape and the structure of the palate on babies, and then there's sucking variations. Moms may be worried that their baby is not getting enough nutrients, as they are not able to see the volume of breast milk that they are receiving. So we need to encourage them and support them that their baby may have normal weight loss of anywhere from 5 to 10% in the first 24 to 48 hours, and then expect to return to birth weight by 2 to 3 weeks of age. We know that poor weight gain has a number of contributing factors. This can include inadequate feedings due to poorly managed breastfeeding and concerns that mom has. Inadequate milk production, if there's any genetic predispositions that might lead to decreased or having issues with breastfeeding, infection, there can be organic issues going on. If, as we talked earlier, if there's any physical anomalies that prevent good sucking or swallowing. These are all going to contribute to concerns for poor weight gain. It's important that mom know that they're going to be giving anywhere from 10 to 12 feedings every 24 hours during the first 2 weeks. If baby is sleepy and there have been issues with weight gain, that's important to wake baby up and stimulate them, try to arouse them so that they can nurse on and latch on and nurse, so that there's more caloric intake occurring. Another issue that is common in newborns is jaundice, and the American Academy of Pediatrics has guidelines and says that it's important, to make sure that you've assessed for this prior to hospital discharge, and to follow up with all babies in 3 to 5 days. It's important that parents have both written and oral information about what to expect, understand what is going on. They need to know that this is an elevated serum indirect bilirubin that typically peaks with breast milk on or after day 7 to 10 of life. And it can occur in an infant drinking an adequate amount of breast milk with no other signs of liver issues. Jaundice from breast milk is more common in Asian and North American Indian children, and siblings with the same mom are often affected. It's important to keep fluid volume up, so encouraging breastfeeding 8 to 12 times a day is needed. This is another good time to manage any breastfeeding problems, and it's important to reassure mom that there's nothing wrong with her milk, and to continue nursing. So lastly, for nursing, let's talk a little bit about pregnancy risk categories and lactation risk categories. Moms that are breastfeeding are going to be concerned about anything that they take medicine-wise, and are going to question whether they need that medicine or they can take it. And their concerns relate to the effect of the drug on the milk supply and the effect of the drug on the infant. So some general guidelines include giving medications that are normally safe for infants or have been tested on infants. Avoid any long-acting forms of medication. Schedule feedings when the drug level is at its lowest. Observe the infant for changes in feeding patterns, fussiness, vomiting, or diarrhea or rash. When considering what medicine you're going to choose, select the drug with the lowest level that can be found in the breast milk. Avoid drugs that inhibit prolactin release, such as your estrogens, antihistamines, and ergot compounds. And be cautious about the use of any herbal preparations. Now, with all that in mind, it's important that you understand the different types of drug categories. For breastfeeding, drug categories for lactation, L1 is the safest, L2 is a little safer, L3 moderately safe, L4 possibly hazardous, and an L5 is contraindicated. And in pregnancy, it goes A as being the safest, B as safer, C as the middle of the line, D, and X. So you have to use these determinants when you're deciding to prescribe your medicines, and you'll find this information either online or in your app that you might use when you're prescribing medicines. It's important, though, that you feel comfortable and have a good reference available so that you can make appropriate decisions. On page 211 in box 11.2, there are 4 different sources that give good information on appropriate medications for pregnancy and breastfeeding. And lastly, we're not going to go into it, but on these pages as well, page 210, 211, there's a section on returning to work. Your mom may have issues with not being ready to go back to work and how she's going to juggle. So there's some good information that you might be able to provide her to offer her support as she makes a decision and the transition back to work. So that's the end of breastfeeding, and I appreciate it. Thank you.